Okay, so I'm Alexis Ezekwe, and I'll be hosting today's ECPG interview. Thank you so much for joining us. So today we're going to be speaking with a pharmacy professional who brings over 9 years of diverse international experience across management and health systems in Europe and sub-Saharan Africa. She has practiced in Portugal, spent 5 years managing pharmacy systems in Mozambique, and she now works in the UK healthcare systems. So her
Correction,
career.
I work in Portugal
Oh, okay, I'll correct that.
right now, yes.
Okay, I'll correct it. So now she presently works in Portugal, actually. So sorry for the mistake. Okay, so her career reflects a deep commitment to patient care, community well-being, and learning from different cultural environments. She's also passionate about health management, social and humanitarian work, and she's contributing to more healthcare systems globally. Thank you so much for joining us today. Please, can you introduce yourself officially?
Thank you, Alexis. I was very excited when I saw your email, and I appreciate your efforts actually to show our work, and so that we can provide more information about our daily lives. So,
Yeah.
as you already mentioned, I'm a pharmacist. I graduated in 24. I did a master in pharmaceutical sciences back to Portugal, where
Wow.
I initiated my practices. Okay. I began like most of my colleagues. I know that a lot of colleagues went to other routes, but I began at the counter of a pharmacy where I learned so many good things and where I could have direct contact with the patients, okay, managing hypertension, diabetes, cholesterol, and all other minor issues that could occur during the day in the pharmacy. And after, so that was around 2 years. After I went to Mozambique, I got to this amazing job opportunity. I went back to my country as a regional pharmacist manager, where I was managing the pharmacies in the north of Mozambique, where I had contact with so many different realities from the ones we are used to in Europe. And it was such a rich experience. There, I also was doing training at the university for the recent graduate pharmacy students.
Wow.
So I could train and tutor the last year students on their pharmacy practice on site. And also, I gave a little bit of help, a few students to help them find their first jobs, which was
Oh, that's
very, very
amazing.
exciting. Yeah. After this little 5 years experience in Mozambique, I left. I had a quick passage to the United Kingdom. That is true. I stayed there a few months on a training program to become a pharmacist manager there. Eventually, I came back to Portugal, but also the UK system has showed me the diverse range of pharmacists in the world and what we can do internationally, and it was very, very interesting. Back to Portugal. I was until a few months ago a responsible manager. I had five stores. I'm working at this big health and beauty, wellness and beauty company. And it's a bit less of the pharmacies. It's a most integrated system. Let's say it's like as you might know, the Boots. So it has different services. I was a manager till a few months ago, and I became a full-time trainer of the same company. So I do training for the new pharmacist assistants that are onboarding, and also on the stores giving training around the products, taking some ideas with them, and to help to progress in general the day routine of the stores.
Yeah, okay, that's amazing. Okay, so you've told us what you're presently doing and your growth and your journey so far. So can you tell us a bit more about your background and how you even became interested in pharmacy in the first place?
Well, I I came with a very interesting group during my secondary year. Everyone was interested in health, so most of my colleagues became physicians, doctors, nurses, and pharmacists. So being immersed in that group, there wouldn't be a way I could escape to some other area. So everyone was talking about this every time for 3 years. I was always interested in taking care of people. Although at the time I didn't know how could I do this? I knew I want to take care of people. I want to deal with patients. I want to cure people. This is what I used to say when I was little. And eventually I became interested in the pharmacist area. I think it's an amazing career. You can be dedicated to so many fields. And it's good to see the progress and the impact you can have in someone that is healed to a certain extent, comes to you, and you help to solve the problem. Sometimes it's just a little issue, but with your help and approach, the pharmacist can be really, really handful. So yeah, I think definitely I became interested. A lot of influence, external influence, but I always wanted to take care of patients and to cure people. This is how the passion began.
I think personally, one thing I really like about pharmacy is how it's so diverse.
Yes.
That's one thing I really like about the profession. Okay, so now that you're in Portugal and you told us a bit about how you train the new pharmacy assistants and all that, and how you manage different places in your health wellness center. So, can you tell us about what do you enjoy most about your current role in pharmacy? And how has this experience shaped your perspective on healthcare?
Well, being so as I was working in as a pharmacist or pharmacist manager for so many years, I was in the ground dealing with great part of the aspects of the daily life of a pharmacy, the team, supply chain, and everything. In this role, I can take all that experience literally and to train people in these areas. Has this is a bit different, it's more health and wellness. We have to be very careful, very accurate, very practical, and very objective when you are passing some training to these pharmacist assistants that work in the stores. So great part of my job is to actually spend hundreds of hours in the room with them to talk about supplements, medication, dermocosmetics, and other topics that surround. And then on the field, I make sure that, okay, if there is any issue or if there's some information that needs to be consolidated, or even with the patients, because a lot of patients come to the store. If I am there, I'm sure that I can take any doubts or questions and help to resolve some problems surrounding our topics. But what I feel mostly is that I can get all these already 10 years of career and to put in practice on a daily basis with the people, with the teams, with everyone, and also with the patients, the customers that we have on the store. So I think our role here is very, very interesting and very broad about giving continuous training in any field that you are, either the pharmacy, the hospital pharmacy, the industry, or the role that you are taking to make sure that everyone is updated with the information, that everyone is aligned with the last protocols of the pharmacy, and that we can deliver the best of our job.
Okay. Okay, so how do you think community pharmacists engage in public health initiatives to improve healthcare equity?
Well, this itself it's a topic for a few hours, as you might know. I can talk a little bit about my experience.
Yes.
Back to Portugal, as you know, with the recent pandemic, it's already been 5 years. It's crazy, but I think pharmacists were a key point of connection. We are the first resource of people that don't have access to the doctor or have to drive long or simply don't have are not included in the health system in many ways, depending on the country. So we are key here to inform, to keep the patients calm, okay, and to promote some public health initiatives. When I began my career, my first connection to this was vaccination. Okay. When it was winter time, it was vaccination time. So I would get very excited when I got the um, the course that we do to administrate vaccines. And I would be very happy to just help the elderly people managing their vaccines at the pharmacy. I would welcome, I would check their medication. So on this specific role, we can attain, we can target the tons of people and help to relieve the health system itself in Portugal. Back to Mozambique, I was also part of this partnership that the pharmacists or the pharmacies itself had with some local government healthcare or health center, let's say this way, where we had this protocol that we have to check if the person had some tuberculosis symptoms and to make their follow-up to the specific health center or to the specific doctor, the specific physician at the time, because the pharmacy is a place where everyone goes like every day without being,
Yeah.
let's say, too formal or having to go to the doctor or don't have that barrier that sometimes that barrier communication that people may feel when they go to the nurse, to the physician. It's a bit like tense. The pharmacy makes everything a little bit easier on this part. It's very close. So in Mozambique, we had to train our team at the pharmacy. I was working with pharmacists and pharmacy technicians and follow that protocol in order to identify potential patients with tuberculosis that needed to go back to the program or to make some specific follow-up. Okay. Um, yeah, in Mozambique, this was it. Back to the UK. I'm sorry.
So
Back
sorry.
to the UK, I stayed there almost 6 months. And the UK health system they are very, very strong at the clinical pharmacist. Okay. So I learned a lot during those times. And one of my roles, as I was doing this training program to become a pharmacist manager, was the methadone program. Okay. Where you also do the follow-up of a patient on methadone. So literally the patient would come, we would have already the dose prepared, either to give it weekly, bi-weekly, or on a daily basis. And this person will be, depending on the situation and on the state of their health, that person would either take the medication in front of us, or if it was already a different stage, this person could just take the medication home with our follow-up, okay, in contact with the physician. So these are three very different examples in three very different countries that show the role of the pharmacist in public health initiatives and definitely can help to relieve the health systems broadly.
Okay, wow, that's so amazing. And I like that you're giving us in different countries. We're seeing diverse ways. Thank you so
Yeah.
much. Okay, so another question is, what challenges do you think that rural pharmacists face in chronic disease management?
So specifically my experience, okay, there are many challenges that the rural pharmacists face regarding, let's say, access to regarding financial issues, okay, support from the government, support from different initiatives. In my case, when I was working in Mozambique, so I was on areas that were very far from the main city. Okay. Uh, uh, in the reality there, I wouldn't consider it to be rural, but actually, everything is so centralized in the main city, in the capital city, Maputo, that whatever is happening around doesn't exist. It's an unfair way of saying it, but it's the truth. And one of the challenges me and my fellow colleagues pharmacists would feel was the transportation of the medication.
Oh,
Okay.
wow.
So it was not easy. And we are talking about supply chain, but literally transportation of medication in conditions to our sites it was thousands of kilometers of distance. And to make sure that you had all the stock that you needed for 2 weeks or a month, or I don't know, depending on the time, it was an issue. And financially, we had a lot of pressure because we had to pay, okay? And of course, I was part of a big company and a big group, but there was a financial constraint with the fact that you have to contact the how do you say? I'm missing the word in English. The warehouses, okay?
Oh,
You
okay.
will have to contact the warehouses. Most of the warehouses are located in the center, and your little pharmacy is miles away from the center.
Yeah.
Even if you want to have the transportation by airplane, it can be a solution, but it's extremely
Too
expensive.
costly.
Okay,
Yeah.
so it has to go by road, which means that the medication will arrive maybe 2 weeks later than we expected because you can't afford to pay like an airplane, transportation. So this was a big issue, and then this directly impacted people that were waiting on the medication, people that had prescriptions, people with diverse chronic diseases, and also some outbreaks that we used to have, like malaria and typhoid. So we need the medication on site at different times of the year, and sometimes it was a bit challenging to face those things. And also the fact that you are remotely, or at least a bit away from the center, you don't have the
Yeah.
same access to information. Even if you have encounters with your colleagues to update information, little congresses and stuff, for us would be a big effort to join these events and meetings. So yeah, in general, this was my experience, and it was not easy, but we made sure that everything at the end would be sorted out, and to find different solutions or alternatives that could help to face the challenges at the time.
Okay. Okay. So supply chain and also, okay, yes, I understand. Okay, so
Mostly supply chain and financial, let's say.
yes. Okay, so how do you think pharmacists can leverage health information systems to improve patient care and medication safety?
Sorry, can you come again with the question?
Okay, how do you think pharmacists can leverage health information systems to improve patient safety and medication care? Medication safety, rather.
Yeah, medication safety. So
Yeah.
we are key to manage medication safety in our sector. What I see nowadays, talking about information systems, with the progress of AI, it's very, very, very useful. But I see also a lot of confusion and misinformation with people.
Yeah.
So this tool is amazing to help us in many, many ways, but also it can be a bit limiting if it's someone that doesn't have any literacy on health, because the person is just reading that phrase, is not considering the holistic process of, for example, taking a medication. So I think here we are key to leverage, to keep informing, and to keep the human contact in this process of dispensing specifically medication, supplements, and other things that people um, can take a bit for granted. Okay. So language definitely, and some communication barriers. We are key to clear out information and to help people regarding this. And I cannot say it anymore, to keep it humanized, and to keep the contact, because sometimes the person just says one thing, we ask two or three questions, and what brought the person to the pharmacy or to the, depending on, to the parapharmacy where I work right now, is an issue that it's completely different. And with your help, you can disclose with more information and clarification. Um, Also, I think some cultural differences can help. Um, let's say, talking about cultural differences. So my experience in Mozambique was different than my experience in Portugal and my experience in the UK. So to say that the perception that people have from health, access to medicines, health information is pretty different, but we cannot assume that because we are let's say, in a more developed health system like we have in Europe, that people know or do not know. And the same happens to some African countries where people have low access to information in health, but also they will find alternatives in more traditional ways. So we are key here to clear these barriers and to make sure that information is clear to everyone, and to help out to sort these problems.
Okay. Okay, so we want now broaden this topic. We have talked about how pharmacists can leverage it. So now broaden it up. So what do you think are the challenges and personally solutions that can ensure equitable access to medicine information across diverse populations? So like how you have talked about how AI and the rest of it. What do you think personally are the other challenges and solutions that we can help to ensure access to medication information, especially across diverse populations?
Well, I think
Someone
health
that
is,
has seen from different areas. I believe you're in the best place to answer.
yes, I think um, well, a lot of health is not unfortunately it's not accessible to everyone.
Yeah.
Um, so this would be the first step. And the fact that there's the barrier, independently of being here or there geographically worldwide, I think it's interesting to just to reduce the gap that that exists between health an health tech specialist, could be the pharmacist, the physician, the nurse, to the patient, because there's a big gap here, and when people go to the healthcare system or assistance, or whatever situation they are looking for, uh, a lot of times is already on the last minute. Okay, so make it more accessible and make the information and the communication also more let's say, easy, understandable. Okay. AI helps us here a lot because it just makes everything very clear. But what's behind that, and that people actually don't need to know, we are here to make sure that we close that gap. Um, I also think that should be more initiatives regarding, sorry,
Sorry.
inclusive care.
Okay.
So doing training at schools with little workshops, I mean schools and universities, making a lot of initiatives in the most minor issues that we have surrounding us, so that the situation doesn't go just all the way left, and it could be something that we could have solved like 2 weeks ago if the person could have identified basic symptoms, like we have for other things. So I think workshops, more inclusive healthcare, to say that everyone should have access, and on a simple and clear way, so it doesn't have to be that distant thing of, oh, I have to go to the doctor, because I still feel this nowadays, even when people, a few patients,
Sorry.
sorry, I'm a bit with a cold, the leftover of a cold. Even when the patient goes to the pharmacy, I still have a lot of friends that work specifically on the pharmacy, and they still have that thing of the daughter of the pharmacy. people pay a lot of respect and can create a bit of distance and fear. So that on the context of a hospital or a healthcare center, it's even more distant. So how can we make us as human beings closer to people on this way? Alexis, I stopped seeing you. I don't know if you are seeing me.
Sorry, it's my network. I think I had a network glitch.
Um, So I would go to close this gap. Actually, and schools, universities are key, even government initiatives to spread communication. Now we have social media there.
Yeah,
So official means of information of health information to spread adequate norms, adequate protocols, and things that people can actually read and understand and not make a big confusion.
yeah,
In terms of products, now we have access to products from great part of the world in one place. The fact that it's in different languages, okay, the labeling is very important. The labeling, the translation, and to make sure that everything is just equitative, everything is just normalized, that everything is just as it should be. Okay.
yes. I think that those are very amazing solutions. The
Mhm.
inclusivity, the trainings, government getting involved. Yes, those are things that we really need. Okay, so now, what do you think are the barriers to pharmacists taking more expanded roles in the global healthcare system? Personally, like, what do you think, with your years of experience, what do you think are the barriers to pharmacists taking more roles in the global healthcare space?
Well, I feel as a pharmacist myself, but I feel that our role is still very under-recognized in many settings. Global health, we already see a lot of colleagues that made their way. But I think the fact that we don't have this connection, more multidisciplinary teams to understand, okay, the pharmacist is key here. We could see in recently, we can see more with contact with um, Doctors Without Borders, sorry. uh,
Yes,
um, Medicine du Monde and other big organizations where you can already see a few pharmacists in some roles, the so-called humanitarian pharmacists. And we can see the work of our colleagues, how they close the gaps, as they are a bit neutral in the system, so it's easier to do negotiating, to make sure the supply chain is there, to make sure that people have alternatives when their medication is not on site, and also facing all the challenges that is to be on a disturbed um, city or with a war or some kind of pandemic or some kind of distress that can happen there. So I think our biggest challenge is to still be recognized by other entities and even healthcare professionals as key um, in the global health advancements. Okay. We are talking specifically of, let's say, disaster settings, but even other public health measures, the pharmacists could have a bigger role, and we have a long way to go there. It's not easy. A way could be through training as well, say, to give us information, because myself, I only got to know about other roles the pharmacists could have regarding public health initiatives and global health. I was already working, okay? It could be the case that I was a bit more closed, but it's either the pharmacy, either the industry, either the hospital. And when we talk about
administrate.
administration, and if you happen to find a nice role in the government rates, but it's very specific because we are still seen as the drug dispenser. Okay, so think
Yes.
something further than that. And I don't want to be unfair because I know that many colleagues of mine are doing an amazing job worldwide in global health. But in general, what I see, oh, you are the drug dispenser. Oh, that's cool. Okay, do you need a graduation to do that? Okay, people ask me this.
Yeah.
Do we need a graduation for that? Yeah, actually, we do not. We do need high qualified graduation, tons of hours of training. So this is a serious issue that people just take for granted because we make it look so simple, and that's our role, okay? To just make information simple to people. So we still need recognition for other healthcare professionals. The population already recognizes a little bit our role, the impact that we had on these health initiatives that I was telling you earlier, vaccination,
Yeah.
methadone programs, exchange of syringes in Portugal. I remember doing that as well when I was working early in my career in the pharmacy. So we are a bit underground. We have a lot of impact, but we are still underground.
Yes. Many people
And
don't know about what we are doing, and
uh,
visibility is key. Many people still don't know how diverse the pharmacy profession is, and visibility
exactly,
is key.
exactly. I don't know how you feel currently. You are working as
Okay, an industrial pharmacist.
industrial pharmacist. That
Yeah.
is great, okay, but it's a very, okay, you can do that, community pharmacy or hospital pharmacy. So going to global health, it's already a big step. And also our university, how do you say,
Curric is it
curriculum.
curriculum? Yes.
The curriculum, exactly. Sorry, I'm taking in Portuguese and then in English and trying to figure out some words.
No, I know, I can
Our
understand.
curriculum, it's amazing. It gives us a lot of training. Maybe in some aspects it could be updated, like having
Yeah,
a
I think
model of global health, public health, humanitarian pharmacist. Even if it's like a workshop or something like that, that could help our colleagues that are still doing their training to become pharmacists in the next few years. Of course, it will be different from at least myself and yourself, but having this already included, you can do this. You can have access to this. If you want to follow the training, you just go this path. And by the time I finished, we didn't have that clue. And being specifically the humanitarian pharmacist, I follow a few colleagues that work, I see on social media. It's amazing, it's of a lot of value, and I still think it's not enoughly recognized.
yes, I think what you said now is very true. I feel like they should really revise the curriculum and add it inside. It's very good if you're already in school and you're already preparing your mind that, oh, you can do this, you can do
Yes.
this. You better align yourself by the time you graduate. But if you come out thinking it's just industry, community, hospital, you won't be aligned. And by the time you even realize it, you'll be too far gone into one specific pathway for you to switch to another. So I think what you said is actually really true.
Yeah, it
They
could
should really
help.
try.
You can
Yes,
still switch, because
yes,
there are many master degrees and postgrads and courses that direct us specifically to that area if you want to pursue your studies or do some extra training. That is, of course, post the pharmaceutical sciences, which is also a nice way to update your information and to rescale what you want to do. So I wouldn't say that it's late. It's never late. If today you discover that there's this role, you can always follow it according to your experience and willingness to do things. But having just a little tip during our early years of curriculum would be nice, and would also be a way of recognizing our work abroad. And we could have, for example, I didn't have any teacher that was coming from specifically global health. Okay, I had
mm,
a few teachers coming from public health, but mostly talking about the initiatives that we already know. We can't take it for granted because it's still a lot of work going on public health, but
Yeah.
going a bit more broad, global health, disaster settings, pandemics, and other things, maybe we need a switch there. Yeah.
Okay. Okay, so now building on how you said that they should revise the curriculum, what other administrative frameworks do you think would better support pharmacists' contribution to universal health coverage? What other frameworks do you advise that would help us to easily contribute to the universal health coverage?
Um, it's a very interesting question and still hard to process, I think. Because let's say we still depend on you want to do a lot of stuff, but you still depend on financial means, government's willingness to put on practice a lot of things. Okay. But I will be forever an advocate of training, training, information, information, information. So the more things you can relieve and make the pharmacist capable of solving, okay, as an highly qualified healthcare professional, the more people definitely will have access to health in general because the pharmacist it's spread everywhere. So the more people can trust the pharmacist and the more accordingly to the clinical situation he can solve and the fact that other parts of the healthcare systems, nurses, doctors, trust the pharmacist into a specific role. I think it will be definitely of leverage and will help to cover a lot of issues because our role has a definition but still a bit lost there in the means and I think these collaborative practices, these multidisciplinary teams uh,
So sorry.
uh,
Sorry.
outside our continuous professional development, the government actually talking about us and showing our need to the population and importance will be a way to support universal health coverage. And the fact that if pharmacists have more of a role in defining legal health policies, so things that can be implemented, things that we see on a first hand, for example, in an informal way. But you can see if you are working at the pharmacy 24/7, you see when something is coming, when there's
Yes.
a specific thing that it's on the air. It can be seasonal, it can be just oh, it's the flu season, but you see when there's something else, because you are definitely having more people with these symptoms, more people are getting this specific medication. So are we taking this information and making it go through the specific, is someone looking at these things? We are first contact with many outbreaks and other healthcare situations that occur on a daily basis. So if someone is looking at this and making sure this information passes, to actually have an action, okay, on a public health aspect, specifically because, oh, we noticed that on this area the pharmacies are selling it more these or these kind of patients are coming more to the pharmacy. So what are we doing with this information?
This information,
I
yeah.
know that in a lot of countries it already is a reality, that the health systems are connected and that actually there's screening methods and other things that help us to make these decisions on a more um, high level, let's say government level, to implement measures. Um, in other places, is this a reality? Is this going to be a thing? So so yeah, there's many layers to this topic actually to cover. But yeah, I would go with training, engaging in multidisciplinary teams, and being more recognized by our governments and other
Right.
healthcare professionals.
Yes. Okay. Okay. So speaking on other healthcare professionals, how important do you think interprofessional collaboration is? And how do you think pharmacists can work more efficiently with other healthcare professionals to achieving the universal health coverage?
Well, talking specifically, so we could see our impact already during this the last pandemic. So the presence of the pharmacists, people were, oh, you really care. We could feel this. More integrated teams. So the pharmacist to be called when there's a decision to be made regarding certain aspects, that pharmacy should be on the table among with other specialists, public health, doctors, nurses, epidemiology, on a straight way, I think everyone should sit on the same table. Okay.
Yeah,
And we are not sitting yet. Some of us are already there, but if we were taking an account on that measure, I think things could be a bit different.
better, much better.
Yeah,
Yeah.
yeah, definitely, yes.
Okay. Okay. So far, do you have an example of a successful collaboration between pharmacists and other healthcare professionals that led to a better patient outcome or improved healthcare access? Like, do you have a specific example where this collaboration worked and it led to a better healthcare outcome for a
For
patient?
example, yes, yes, sorry, you're saying?
Okay, so I was saying that led for a better patient outcome or improved healthcare access. Do you have an example to tell us?
Specifically example as in my career.
Yeah,
At the pharmacy we use in Portugal, it's very common to make the track of the hypertensive patient. Okay, so the person goes there every day, measures their blood pressure levels, we check the medication, and although we still have a long way to go, having a written protocol to manage these parts, we already are improving that patient's um, situation by being able to monitor it. It depends if it's on a daily basis or for a few weeks, or if the medication changes. Um, we can closely monitor the blood pressure levels and check if everything is okay with the patient, and if there's something else going on. The same with diabetes management with our patients. We can also have this integrated collaboration with the physicians. And a few times I had to make a few phone calls to the physician to just let them know about the results, or how were things going on with that patient. So to make sure that we were aligned. Um, in the case of the UK, I
yeah,
think they are a bit more advanced on these aspects, as you can have the role of the prescriber pharmacist. Okay, you do the specific training, and this relieves a lot the health system. If it is just the renovation, not just, okay, I'm being unfair saying not just, but renovation of medication, you have access to all data. And of course, in contact with the physician, you can also make some adjustments and to make sure that the person has the adequate medication to their state. Um, and along with the hypertension management in the UK pharmacies, you can also find a very structured system to manage the HTA patient, which I think it's very very important. There's no words to describe, because you can do that just going by the pharmacy. We are so approached, we are everywhere. So why not taking advantage of this and to help to relieve the health systems worldwide?
Okay. Okay, so I've seen that you're so big on trainings, information, getting the right information from the right sources. So I want to ask now, what role has mentorship played in your own professional journey?
What role has?
Mentorship played in your professional journey? As someone that is so big on information, trainings, asking the right person. So has mentorship played any role in your professional
Oh,
journey?
definitely, definitely. Mentorship in the most various ways. So for me, it started back when I was in Mozambique, actually, with the trainee students that I had. So it was a clear role of mentorship, of direction, and it helps me to be again on the shoes of someone who is about to finish, who is anxious, who doesn't really know the path. And if a student comes to me and of course has the willingness and wants to make efforts towards a more clear career path or has some questions, I'm always happy to help. So I really need to
Oh, that's
understand, I really need to understand their needs. And I also, if it's needed, just okay, this I know that you want to be an astronaut, but I also need to let you know that this is gonna be difficult. So are you ready for this? You know, something like this. So definitely it keeps me approach of the most recent students to know how they see the pharmacy. And the most interesting, it's what are the efforts or what do they think that in 10 or 20 years we'll be able to do. And it's also very interesting to have just having a fresh mind, you know. After a few years in the career, I'm still young, okay, but it's good to see the generation below you. Oh, they are so interesting. They are doing this. They are doing this project. They are trying to do that, and I find that amazing. It helps me to keep myself updated, to understand the trends, and I always try to give my best. Although I have a bit of a crazy schedule and very busy, but I always try to keep on with whatever mentorship situation appears.
okay. Okay, that's amazing. Okay, so how do you think early career pharmacists like me can find mentors who align with our goals and our values? Like someone that you said you have had a lot of mentees under you too. What specific approaches did they approach you, or how did they approach you that made you willing to mentor them? So, what advice do you have? How can we find people that align with our goals first? Because as a mentor, you must find someone that aligns with your goals personally. So, how do you think we can find those people? And also, what approach do you think is right?
Um, I think it's fair as a mentee to try to have an idea of how would you like to be in a few years, or right now, what do you think you want to achieve, like from in a year, in 5 years. I won't go 20 years, but let's say in a year, what do you think that you would like to do, or what would you like to be as a professional? Definitely, social media is there. There's LinkedIn. You have many amazing professionals that you can see their career paths. Okay, myself, I have mentors as well. I have people that I follow that sometimes I check in. It has to be someone that it's somehow easy accessible, okay, and that you can literally just message to take a doubt, or every in a few months just to check in to see if everything is all right, that can check your CV, that can help you prepare for an interview. Okay, these are very important aspects that I think that in early career pharmacists, these are tools that are not given at the university. So it's a bit
Yeah.
different. So find someone that you feel that, okay, I could sit with this person and talk for a few hours, that has a career path that you are looking forward either to follow or to take examples. And also mentors can help you a lot in the way of, okay, there's a lot of little mistakes that we'll be doing on our careers, and the mentor can help you ease that out. Okay, if you have a nice mentor that can ease you out or direct you to the specific person, the specific institution, the specific meeting or situation, that is good. It won't be the mentor that will give you the path, but definitely helps clarify. So find someone that you think, okay, I could sit with this person and talk for a few hours and to understand what have they done, how what were their challenges, what is something that they did that I'm not feeling like doing, but I want to know why didn't they go this path or that path? How do I see myself going this or that way? What do I want to do in the next year, on the next 5 years? Okay, that can, it doesn't have to be a match to your profile. It's not about profile matching, but it's more about willingness to work together. And it helps to be, although it, for me, I find it challenging, okay, to find the real time. I wish I had more time to actually mentor. But find someone that has the willingness to do so and to help others. I think it's the way that we can grow and progress.
Okay. Okay. So looking forward, what do you think the future holds for the pharmacy profession in terms of its contribution to global health and also universal health coverage? As someone with so much years of experience, yes, I know you said you're not old, but
I'm not.
what do you think? Yes, yeah.
Do I
But
look
like,
perhaps, but I'm not.
no, you don't. No, you okay, no, you don't. But like looking forward, what do you think the future holds for the pharmacy profession?
Well, we have a long way to go. I definitely see pharmacists more and more engaged in global health topics. I think as the world is evolving in a certain way, and I wish that in 10, 20 years, even myself, who knows, but more engaged in global health platforms,
Okay.
in writing or being part of tables that define to strengthen healthcare systems, to write health policies. Okay, I definitely see us more with a stronger voice on that area. Okay. And I still think and I hope that we are still that close person that anyone can reach to just take any. I don't want this to be lost, you see.
No, I don't see us not being, we'll always be the easiest accessible for health
The
professionals.
easiest, yeah, I want us to keep on this close, to a certain extent. It can sometimes we create relations with our patients, close, intimate, that people can still trust, even though with all these digital uh, tools that we have nowadays. May that these tools help us to strengthen our knowledge and have easier accessible access to information. But I'm still looking and in preaching for humanist patient care, which means being close, being attentive, being compassionate. Okay, sometimes it's a bit lost in this fast-paced world, and I'm willing for us to keep being this person of reference in our communities.
Okay. Okay, so what advice would you give to early career pharmacists like myself who aspire to make a meaningful health impact in the world of the universal health coverage and health transformation? So, like how you said in the future, you see the pharmacy profession inclining more towards policy making, global health topics, and all that. What advice would you give us, like as early career professionals? pharmacists to better
Well,
position ourselves for the coming years to come?
for the coming years, if you want to engage in that area,
Yeah.
I think that's amazing, and I really advocate. And start earlier. Start with curiosity in your own community, in your own neighborhood, joining associations and worldwide recognized institutions as FIP. It helps because it keeps you in touch with a wide range of pharmacist colleagues and gives
Yeah.
us access to ton of information that otherwise it would be a bit difficult to have in certain parts of the world. Definitely keep engaging on that. Find your little purpose every day, okay? Because we see as this big thing of universal health coverage, but what can I do today? What have I done today that has somehow changed or took me a step closer to that goal? Because it's not going to be one day we wake up and oh, everyone has access to medicines, everyone has access to health, everyone has a pharmacist, a nurse, and it's not going to be like that. But what are the initiatives that I'm taking today close to my community? So it can be local, it can be global, okay? It can be cross countries, it can be in many different approaches. But here where I am today, what have I done? Is there anyone that I've helped? Is there anyone that I've helped reach certain information? Is there anyone that I have clarified information? Is there anyone that I've given some advice on medication and has helped to relieve their day? Okay, so I think it's the little things, it's the little step by step. Don't lose that.
Yes.
Has been a bit younger, but don't lose that curiosity. Don't lose that step by step. Sometimes we want so much something, oh, I want to do this, I want to do that, I want to work on that NGO, I want to do this and that. Yes, don't worry, you'll go there. But today, what have you done? This is my thoughts. As a pharmacist professional, specifically, of course, as a human being, there's a lot of things that we have to question ourselves. But as a pharmacist, what was my role? What was my contribution to my colleague next to me who doesn't understand anything? To my auntie that sent me a message about this thing she saw on TikTok? So I think this is our main to keep ourselves grounded. Also, keep yourself updated. Keep studying, okay? Don't lose that curiosity. Keep studying, keep engaging in initiatives, keep talking to colleagues locally to see their challenges, and even internationally, cross borders. What are they doing in, I don't know, in China? What are they doing? Okay. What are they doing in Australia? Is it the same? Can I apply some things that they have there on a daily basis, or is it too much for our reality? So I think that having that open-minded approach, keep curiosity on go, will definitely help the early career pharmacists.
Okay. That's an amazing advice. I think in summary, I think I was watching a TED talk recently that said 1% better every day. What are you doing 1%? What are you doing each day to improve
Mhm.
yourself? So that's an amazing advice. Okay, so do you have any final words for us? Any closing sentence? Anything you have to say to us, early career pharmacists?
To the early career pharmacists like yourself, Alexis.
Yeah.
Also sometimes I chat with Emily. I think you are amazing. Okay, I think you are doing an amazing job. And let's say I can say this with property, coming from places with not so much easy access to health. Okay, and the fact that you want leverage our profession and you are really making an effort so that the world can see, okay, we are trying, we are doing something, we want to know more. So please keep doing that, ladies. Okay, don't lose that. And keep yourself engaged in initiatives like this, talking to healthcare professionals, studying more, traveling, getting to know each other, to know how you definitely can reach the top of the world. This is what I have for you. You have
Thank
an
you.
amazing career in front of you. So, yeah.
Thank you so much. That was a very nice closing sentence. Thank you so much for your time. We really appreciate us. On behalf of the FIP ECPG group, we really appreciate your time. Thank you so much.